Welcome to this episode of That's Good Science, where we salute the tireless translational researchers who analyze genetic disease. Today, we recognize the work of Kazushi Izawa and colleagues, who've streamlined the detection of NOMID, neonatal onset multisystem inflammatory disease. Imagine bringing home your new baby, but within the first 3 months, he's covered in a rash and suffers recurring fevers. It could be an allergy, it could be a virus. But for 1 in 1 million babies, it's NOMID, a dominant disease caused by a gain-of-function mutation in NLRP3. The disease rarity and symptom variability makes NOMID difficult to detect. But early treatment can prevent some long-term consequences of NOMID that can lead to developmental disorders and, in 20% of untreated cases, death. DNA sequencing can easily identify 60% of cases that have heterozygous germline mutations in the NLRP3 coding region. But in the remaining 40% of cases, patients show clinical symptoms but no detectable NLRP3 germline mutations. But there's a high incidence of somatic NLRP3 mosaicism in these individuals, causing low levels of mutant allele copies within their blood samples. It's a classic needle in a haystack scenario. How do you detect rare copies of the disease allele? Typically, by sequencing hundreds of individual NLRP3 PCR product subclones per patient, but this is labor-intensive. Next-generation sequencing technology can help, but can an NGS method detect rare alleles? In other words, will informative data rise above the noise inherent in massively parallel sequencing? It will if you follow the method developed by Izawa and colleagues. By using high-fidelity prime-star GXL polymerase for PCR prior to pyrosequencing and careful statistical analysis, they detected NLRP3 somatic mosaicism with greater than 99.9% confidence, even when disease allele frequency was as low as 1%. While this is great news, it also offers a potential approach for using NGS to detect other low-frequency somatic mosaicism, which can occur in many tumors. And that's good science.